Okay, let's tackle one of the biggest questions in hospital medicine: when to give blood.
So a patient is anemic. Should you give them blood right away or wait? It's not so simple.
Anemia is super common in hospitals. It can happen from illness, surgery, you name it.
For years, doctors have been split. This debate basically created two different schools of thought.
One side says transfuse early. The other says wait, transfusing only when absolutely necessary.
So which one is actually better for patients? Well, to find out, we have to look at the data.
And I don't mean just one study. Researchers did a huge Cochrane review, a study of studies. They looked at 61 different high-quality trials. But that's not even the most impressive number here.
Get this, data from over 23,000 patients. That is a massive sample size for sure.
And the process is incredibly strict. All this work is to make sure the final results are rock solid.
So what did they find? When they looked at the biggest outcome, death, the answer was surprisingly clear.
Take a look. The death rates for both strategies were basically the exact same.
So, the big takeaway? For most patients, waiting to transfuse wasn't any more dangerous.
And it wasn't just death. Same story for heart attacks, strokes, even serious infections. No difference.
And patients didn't feel worse either. No difference in quality of life, fatigue, or mobility.
Okay, so waiting is just as safe. But is that true for everyone? Medicine's rarely that simple. Turns out, there's one big exception: severe brain injury. Here, giving more blood might actually be better.
And maybe for heart attacks too. For some really high-risk patients, more is better might be right.
But for most people, waiting is safe. And this isn't just theory. It has huge global implications.
Think about places where blood is a scarce, precious resource. That's where this really hits home.
Blood supply can be low, screening isn't always perfect, so avoiding unnecessary transfusions becomes critical. So, waiting not only saves blood, but it can literally save lives by improving overall safety.
It's a huge shift in thinking, and it makes you wonder, could less is more be the future?